Yes, we can start.
Oh, just by way of with regard to the webinar on the 18th of December, where we actually get to meet and chat with those who were involved in the negotiations. We will in this and through social media and email send you a video to that was prepared. The video is largely on the whole period of the negotiations. It's a very short video, but it's very informative. For those who will be joining us, for those who are part of the course, please keep in mind it is advisable that you watch the video before you actually join the webinar on the 18th. And if you have any questions, please send it to the group, uh, and we will collect all questions prior to the hosting of the webinar, so that we can then pose those questions to the panel itself. So please keep in mind, we will send you the details of the video, and we hope that you will have a chance to view it before the actual webinar itself. All right, with that, I think we can start uh, now.
Yes, we will.
Yeah. All right. Okay. So, uh, good morning, good afternoon, good evening, everybody. Thank you once again for joining us in this webinar series on the GCM. Today, we have come a long way. We have come more than halfway. Today is objective 15, and we have 23 objectives to go through. Like I said, we will take a break for the winter and Christmas after this webinar, but we will come back with Objective 16 on the 5th of January. For Objective 15 today, which is about providing access to basic services for migrants, we have a very good panel. And I will call upon the panel. I will introduce the panel, and I will, as usual, inform the panel that this is meant to be very interactive as far as possible. And I will start with a broad question to you, expected that you give a response of about 2 to 3 minutes, and then I will do follow-up questions. You are also free as panelists to build on or borrow from or interact with something that one of your other panel members have said. After doing a round with the panel, I will go to the floor for any questions that you may have. Share with us as to what they are hearing from the panelists and some of their own experiences with regard to Objective 15 in this. And this is how we do it all the time. After this, this webinar will be available on YouTube after we have finished. For the students who are following this course on the GCM series, so that they can do further research and in depth understand the issues that we are tackling here. So thank you once again for all of you, for those who have been consistent with us from day one. I don't even remember what date it was, on for 15 Tuesdays together. So that has been a long journey already. So thank you for being with us, and thank you for continuing to show interest in this. For the panelists, thank you for giving your time. We know that these are difficult times for many of us. And work has changed our lives in a very big way. It takes more of our time than it used to take prior to COVID. So when you give a little time for things like this, it goes a long way in what it can do in terms of bringing about change and hope and and the reason to continue in the struggle for transformation and meaningful societies. All right, so let me begin then with the panel. I will start with Dr. Poonam. Uh, and Dr. Poonam, to begin with, she is the Senior Migration Health Policy Advisor of the International Organization for Migration in Geneva. She's at the headquarters itself, and most of her task is to advise member states and partners on actionable migration health policies that are aligned with leading global health strategies as well as migration management principles and priorities. So, Dr. Poonam, if there's any time to have a discussion on health and issues around health and services on migration, now is not, there is no better time than now. The world has been practically shut down by a global pandemic. And so it's good that we are reflecting on Objective 15 and what it means for migrant workers. And I guess the big question that has been floating in the migrant communities, in countries of origin, in countries of destination, is how can you ensure equitable, safe access to health services for migrant workers? How does the Objective 15 actually spell that out? If you could respond to that.
Thank you, William, and thank you to the colleagues organizing and co-organizing these webinar series. Happy to be part of number 15 today. So yes, in terms of how Objective 15 addresses equitable and safe access to health services, I would say for migrants overall, not specifically only migrant workers, although of course a large proportion of international migrants are migrant workers, as we well know. So as you pointed out already, GCM 15, the Objective 15 addresses services, of course, across a wide range. So you have health, education, you have social services, integration, etc. In terms of health, I would say the first key point is to bear in mind how the GCM actually is coherent with other key global health policy frameworks. We have the Global Action Plan on promoting health of refugees and migrants that member states have explicitly recognized also in Objective 15. And what does this mean in actual practical policy terms? It essentially means an effort for progressive realization and incremental inclusion of migrants, regardless of status, in national health plans. And it also means that national migration plans or policies and frameworks, for example, for labor migrants, are inclusive of addressing equitable access to health services. So we have seen some movements in the right direction, both during GCM negotiations and of course since conclusion thereof. For instance, in countries like Nepal, which has actually adopted now a strategic action plan on migration health, which seeks to make a more coherent approach across the different ministries and government towards migration health, as well as a Myanmar migrant health policy framework that was adopted in that country, again, trying to look at migrant inclusive health services and programs. Further to that, of course, there are many efforts by IOM, say as the UN Migration Agency, working closely with partners like WHO who are here with us today, as well as others, especially when it comes to access to services for those migrants who may be marginalized or in vulnerable situations, migrants in irregular status, stranded migrants, which unfortunately a lot of our migrant workers around the world have found themselves in a situation of, even with the pandemic, and how there can be targeted programs that complement government efforts in order to bring access to services, whether through mobile primary healthcare clinics, or via intensive, culturally appropriate health promotion and education, which enables the uptake of basic services, if you will. So I'll stop here in terms of a brief 2 to 3 minute reaction to your question, William, and happy to continue to engage with the participants. Over.
Thank you. Thank you, Dr. Poonam. And it is, and I agree with you that the objective does spell out what could possibly be done. Uh, but just to be clear as well, that what are the can you see how realistic is this in the terms of that it is happening? Because one of the challenges in this pandemic has been precisely that, is that access to services, and particularly health services, and particularly to migrants irrespective of status, was varied, to say the least, in most destination countries. uh, so how can the Objective 15, aside from being this where the language, how can it be actually translated, really implemented on the ground? What weight does it have in making sure migrants have that access?
So, in terms of the weight that the weight that one particular objective has, I would say is, of course, the same as the weight to all the objectives of the GCM. The GCM essentially making an effort to indeed have that 360-degree view in terms of policies related to migration and directly affecting migration. So, yes, if you're speaking of the COVID-19 response related efforts, we have seen that several national preparedness plans and several outbreak response plans in countries or even at local level have found that not having included migrants has been a limitation, because there was not that contingency, there was not that preparedness to ensure that outbreak related outreach, education, access, be it to testing, be it to being able to access the right information, has been challenging, because we have seen through previous studies as well that in many countries, migrants were actually not formally part of national preparedness and response plans. I would say that the objective, clearly making a link with the Global Action Plan for promoting health of refugees and migrants, does provide an entire menu, if you will, of practical actions that can be taken, and some of which have been taken in some member states during COVID. For instance, some of us are well aware of how Portugal has been making sure that even those who are still in process of getting regularized in terms of their migrant status had same and equitable access as citizens to COVID-related testing and care. Similarly, free universal COVID-19 services have been provided. We see some good examples even in the recently launched State of UHC report, where countries like Turkey, like Singapore, for instance, vis-a-vis migrant workers, have at minimum put in place measures, albeit temporary. And in some ways, this will be an opportunity as well for all of us working either at local, government, or UN level globally, to continue this advocacy that some of these measures that are temporarily in place for migrant inclusion indeed become more permanent going forward, not only for GCM Objective 15, but keep in mind, most countries are committed to SDG 3.8. They have UHC commitments, as we've seen in the recent State of UHC report. And including migrants will only enable countries move forward towards achieving their SDG commitments as well. Over.
Yes, and thank you for that. And I'm so glad you brought out the SDGs, because Definitely, I think while there is still some traction to be built around the GCM and its implementation, it's still very young kind of thing. It's only 2 years and 1 year since its adoption, and 1 year has practically gone in a lockdown kind of thing. The SDGs are there to kind of guide this whole notion, and I'll come back to you on this, but in terms of what you have said, the need for an advocacy for this guidelines to become real, but it also therefore means then that somewhere that public health services, more resources will have to be put into public health services kind of thing, in terms of even reaching this goal like the SDGs kind of indicate. Um how are we going to is that one of the biggest learnings we have seen, that public health services have suffered over time because of the economic paradigm that we currently kind of have? Will this be one of the big learnings of the COVID, that we have to prop up the public health services? And what is the role of the UN and IOM in making a case for this as well? I'll come back to you on that to give you a thought as I to give you time to think about that as I move on to the next speaker, next panelist. And I would like to call on Kanokpon uh, Kaojorian. I hope I got that right. Close, at least.
Please
Close.
call me Zoom, easier.
Okay. Okay, June. Thanks. That will be great. Just to ask you as well, it's the World Health Organization, and you have had a major role to play in these days, kind of thing as well. And you are also one of the leads in the UN Network Working Group on Access to Services, which actually is all about Objective 15. Uh, can I just ask, how has the working group looked at the current situation and had to, because obviously Objective 15 was written prior to the COVID kind of thing.
Mhm.
So, and the COVID posed real challenges to Objective 15. And we've just heard Dr. Poonam give some examples of some countries that tried to do the right thing, and we know that many failed in doing that. Uh, but as you were in the working group in this whole period kind of thing, how did some of what is happening now inform the working group? And how can the working group then inform the states or work with the states in how to make Objective 15 real? The floor is yours.
Well, first, thank you very much. Thank you in inviting me. For me, I'm a migrant myself since 1987, leaving my own country. So this subject, it is in itself is my own passion. For me, I work at WHO. I'm leading on the work on country support and partner coordination. And I also wear another hat with the UN network where I'm leading or co-leading the working group on access to services for Objective 15 of the UN network on migration. For those of you, I don't know whether in previous session or other objective, you know a little bit about the UN network. Basically, it have different working groups, and there are 6 working group in total. And this is the working group that dealing with services. For us, we have a member of 18 organizations, ranging from UN organization. We have FAO, ILO, IOM. Poonam is one of our member. OSCHR, UNAIDS, UNFPA, UNICEF, UN Women. And also we also have NGOs such as Caritas or the the Child Initiative. We also have the labor or worker union, PSI, with us, the Red Cross, and another organization dealing with specifically with undocumented migrant, with the network of 500 organizations in there. And also, very importantly, we also have the local government, UCLG, with us in this working group. Now, previously, before the pandemic, our working group already set up the priority areas. What are the key services that we want to tackle? because we cannot just go into all different services, but we try to be focused for the first year. And this focus on the first year would include health, housing, water and sanitation, education, decent work. So these are included in our work, and we have developed the collect practice from countries, from partners that who have already started collecting, from our members that have already collecting good practice done by countries or by partners or by cities. And we have also worked on the collection of all of the guidance or tools that produced by our members. Remember that our members are the leading technical agencies in their sectors that I mentioned. And when the pandemic strike, how do we to respond to you? How do we agile ourselves into responding to the pandemic? We have reprioritize our activity, and basically we develop a policy brief on access to services, and in response from the pandemic in the context of access to service, providing services to migrants. And with this one, we have expanded the area priorities. Instead of 5, they include health, water, sanitation, housing, and education and decent work. We have expanded to 10, for example, to cover, for example, child protection services, also social protection services, sexual and reproductive health, gender-based violence services. So all of this is what we have done in response to the pandemic. There's a lot more to be done. Our group are still discussing on the priority for this coming month. Apart from now trying to finish the work on the collecting but the best practice, we are now looking into what more that we could support, because we see a lot of impact from the pandemic to migrants, in particularly in the area of access to services. When we look at health, many still have no access to services, vaccine deployment and prioritization, allocation and deployment. We still want to make sure that migrants is also have equally access to the services. So this is something that is still on our plate that to be done and still under discussion. The issue of education, where we see that many migrant many children of migrants, because of the stay home, many of them are at home, but then they are now, because of lack of access to services, then they have no education. They cannot join, they cannot continue with education. The same thing with many that are stranded and have now been evicted from their employers, or they sleep on the street, become homeless and all of this. So this is the area that we will be working on it. I will stop here for now. I hope that answer your question. And then maybe I can come back maybe in the next round or another round to talk a little bit about what we do on the health sector. Thank you very much.
Thank you for that, June, and it's impressive how you started by identifying priorities, and that's great. The 5 priorities, and then with the COVID to extend that, and I see some very important areas it extended into: child protection, social protection, sexual reproductive rights, gender-based violence. So it's fantastic how the COVID did inform the necessity to extend services. I was just wondering, the approach then of the working group is to at this stage to collect the kind of best practices around these kind of issues, and then to be able to what's the next step after collecting the best practices? What is the next step? And was this not already there? You mean in all this existence of the UN, we still were not able to go to one place to see the best practices around health globally?
You spot exactly on the right spot. Of course, each agency over years have collected good practice or best practice, but they are scattering here and there, right? You would have, we have done our work in order to develop the global action plan promoting the health, refugees and migrants that Poonam had mentioned. We have done the collection of the practice, because the action should be based on what already been done and the success, how it pan out before we start recommending other member states to take action. So that has been done, but it's scattered by different agencies. And with this one, our group have been of course, collecting first from the group, from the members that we have leading technical agencies, put in one place under the UN network website. You also have another side. Cities also have collecting. So we are collecting, combining them. And with this one, the UN network, as you probably know, there is a knowledge platform that is being developed, and I think that it's already almost in function. Probably from this month, maybe from the International Migration Day. With that one, it's a forum where they will put all the practice collected by different working group or by different partners or by different organization there. That's where you can find. Now, in terms of, I don't know whether this is answer your questions, and are they remaining from here that I should answer? Oh, also I should add also the network we work with right now. Of course, it works with all member states, but the way how it's set up right now is that because there are member states that less keen, and the member states are also very keen on the implementation of the GCM. So the network has identified and working with member states and identify 15 countries have come forward to become a champion countries. And these champions countries also provide very much input into the network, into the different working groups on the different, providing example of good practice, providing the venue also for testing, field testing of whatever product that are producing by the network working group. Over back to you.
And thank you for again. Thank you for that with regard to. But that was going to be my kind of follow-up question in some way, where you have mentioned about the champion countries and the 15 countries have come forward and things like that. But I also do know that the 15 countries are sort of tied somewhere with the funding as well. That is under the uh, implementation, or are these 15 countries, these champion countries, largely coming on the objective 15 or overall on the different objectives?
Oh, they come for the overall implementation of the GCM, and it's not necessarily linked to the funding. For example, you have Portugal, you have countries like Nepal that have not received the money from, if you refer the funding to the multi-partner trust fund, of which WHO is one of the 12 steering committee. No, the champion country is not linked to funding. It's linked for more country interest in support, in country commitment to the GCM process during the negotiation as well as during the implementation. For example, you see Mexico, you see Ecuador, you see Bangladesh, for example. These are champion countries, or some of our champion countries.
Okay, and I will come back to you. I'll ask you to, if you can share with us in this period, did any government come to you seeking help on what to do in relation to migrant workers, and particularly from this region, let us say from Asia, Middle East, Africa kind of region, did any government come forward? Let me move on to the third speaker, and I'll ask, and this is on the ground itself. We have Wilfredo. If I and Wilfredo is from the network of cities. He is with the city government of Naga in the Philippines, and Wilfredo is responsible for part of the city planning and development coordinator. Uh, Wilfredo, I'll refer to you as Willie because your name there is Willie as well, or at least on screen. And just to
Yep.
pick up uh, from the conversation earlier, uh, what have you all been doing at the city level, given that there are many Filipino migrant workers who might have been returning, and part of that return process, and some migrant workers who may have been stranded, who were supposed to go but were not able to go because of the COVID. So at the city level, what were the kind of services that you all were offering, or you all felt the need for creating for migrant workers? particularly in relation to Objective 15. Really?
Good morning, good afternoon, good evening, everybody. Yes, thank you for that question. Right now, we have established a Migrants Resource Center at the local government level. So this is in an institution within the city government that tries to address the needs of returning overseas Filipinos. By our count, between March 16 to end of November, we have already processed about 1,000 returning overseas Filipinos. Essentially, what they do is to coordinate with national government agencies to make sure that the return process is seamless and as painless as possible. Although there are challenges there. The advantage of having these kinds of services at the local level is that you try to bring the circle to bring the process to its logical conclusion. We know that COVID hit us very hard and was a big surprise at the start. But the presence of local institutions like our Migrants Resource Center at the local level, together with the Committee on Migration and Development at the regional level,
Sada, did we lose Willie?
There is some miss. I think the voice is gone. Not on mute.
Willie, we seem to have lost you.
Some network issue.
Yeah. And unfortunately, how am I coming now?
Clear. Now go ahead. Go ahead.
It seems I'm suffering from poor internet connection.
Now
Go ahead.
fine.
Go
Okay.
ahead. Go ahead. Yes, go ahead.
How am I coming now?
Clear.
Still problematic?
No, clear.
Okay.
Please continue, Willie. Willie, please continue. All right. Look, let me do this. Let me see when Willie comes back, if we can get him. And it is interesting to see how at the city level they have been dealing with this through the migrant resource centers with 1,000 returnees who have already come back. But let's hope he comes back and is able to give us more information about how that works. But as we wait for Willie to come back, Willie, can you hear me now?
Yeah. I'm hoping the internet connection is better.
Okay, go ahead. Continue. Finish what you were saying.
Yeah. What I'm saying is that there is value in having local institutions like our Migrants Resource Center. It's a division level unit under the Livelihood and Empowerment Department of the city government. It is being complemented by the Committee on Migration and Development. So this allows local governments like Naga to work with national government agencies like OWA and POEA to make sure that the returning overseas Filipinos, who by our count between March and November have already reached 1,000, to at least come home in a safe manner, so that they'll have a semblance of continuity in their lives. And if they choose to do so, can go back abroad if the situation improves.
Thank you for that, Willie, and it is great that the Philippines has this kind of, and I know that the program was quite well in place in terms of absorbing the returnees. Just very quickly, the returnees were largely, that 1,000 plus were largely from which part of the kind of
Um,
world?
uh, by our count, most of them are coming from easily a third are coming from Southeast Asia. Another half are coming from the Middle East. So these are usually the centers of migration or the destinations of Filipino workers that are coming back to our local shores. By the way,
And just
this represents
go ahead.
around 20% of the total returning residents. So meaning to say, out of every five are stranded local residents. One out of every five are international workers coming from abroad, going back to our city.
Okay. And as you were processing this 1,000 plus who kind of returned, uh, what was the information that, because just to keep in mind the two earlier panelists who talked about migrant services, and we were focusing somewhere in destination countries, what were you hearing from these migrants who had returned in terms of services, particularly health services being offered to them in the destination countries? Were they pleased with the services? Did they get the services? Were there complaints? What was the condition of these returnees?
The situation actually is mixed. Some of them are working in ships who unfortunately had to stop operating because cruise ships are hit hard by the pandemic. Some are land-based workers, especially coming from the Middle East. We encountered some problems with those who actually were not able to get their salaries anymore because the um, the ones hiring them are no longer in a position to do so. So what the government, both national and local, is trying to do is to make sure that for the interim they are able to return home, pick up their lives, and then if they, as I've said, if they choose to do so, prepare to go back to their destination country when the situation clears. So the situation is mixed. There are persons or there are overseas Filipinos who are better off when they come back, but there are also a number who really need the help of government. That's why in our case, the local government set aside around 20 million, one to allow or to provide initial capital for returning overseas Filipinos, both local and international, and then provide stopgap community employment for those who need employment. And this is mainly because of the COVID pandemic's socioeconomic cost to the local economy.
No, so that's great. And this 20 million, you're saying this is only the local government, because there was also
Yeah.
money from the national government that was made available, isn't it?
Yeah, this is purely local. We had to realign our budget. We found that we have some 80 million free out of the savings that we're able to generate and the belt tightening initiatives of the city government. Out of that 80 million, we were able to allocate 20 million for this business stimulus fund and community employment program.
All right. And how many of these 1,000 who have returned, how many of them availed of such services? And
I have yet to have a tab on this, but there is a special window for overseas Filipinos that actually allocated 3 million specifically to address the needs of the overseas Filipinos. I don't have the exact count right now, but it is something that I can share with you after consultation with the appropriate department handling this program.
thank you. And I would, and maybe for you to, as a follow-up question when I come back to you again, is for you, if you could share with us, this is the city of Naga. And just for the rest of our participants on the panel, to know that does the city coordinate with other cities in the Philippines, kind of thing, and how is that coordination done? I'll come back to you on that
Sure.
as I move on to the next panel. But for the next panelist, I'd like to talk to Dr. Adelina. And Dr. Adelina is a associate professor in the Department of Family and Community Medicine in the College of Medicine at the University of the Philippines, Manila. She has also been part of many social movements that focus on universal health care and has championed this cause for quite a long time. Dr. Adeline, you've just heard that from IOM and WHO, this whole question of making services accessible to all and this whole process of gathering of best practices and things like that. You have yourself been in this campaign calling for universal health care access kind of thing. Where do you see some of this going, in the sense of, is this coming out of the COVID, is this going to be something that states will begin to champion? Have we finally gotten to that point where we recognize that, yes, we need to we live in a time where universal healthcare should be mandatory, available for all? The floor is yours.
Thank you very much, William. And thank you to the Migrant Forum Asia for this invitation to be part of this very stimulating and interesting discussion on the GCM. So actually, I've been listening to the previous discussions, and I can really say that the COVID pandemic exposed a lot of weaknesses and gaps in the public health system. And really what we have been striving for and advocating for in terms of people's right to health has been challenged and tested. And here I'm using the Philippine experience really as something that is not very good in that sense, because our experience really did not address much the health measures or the health interventions, because what we had was really a militarist approach. And even for our overseas Filipino workers who came back here, they experienced a lot of discrimination. And because when they came back, they had to be quarantined before they are allowed to go back to their provinces. But the quarantine areas in the city were very, very lacking. And even the areas that were given to them, like the Rizal Memorial Stadium, was not really an adequate place for a quarantine because they were all close to each other. There was no physical distancing. They were not even wearing masks. And the tests that were supposed to have been done for them was not done in the context of free testing. They had to pay for the tests, and the tests was done in private laboratories, and the cost really varied a lot, from 3,000 to 15,000. So it's so exorbitant. And a lot of our overseas Filipino workers who already did not get their salaries because, as was mentioned earlier, some of their companies closed down and they were not given the commensurate salary for their work. They did not get it. So they were really asking for the support from government. And for us in the Philippines, the government support was really very lacking. And here I could call on the Universal Healthcare Law, which we passed in 2018, as also not really the law that we hope it would have been, to have provided these services to the people, because our law is being implemented not as a universal healthcare law, but as a universal health coverage law, which means you have to have premium of insurance. And PhilHealth, the Philippine Health Insurance Corporation, was identified as the financing mechanism for making sure that the services under the universal healthcare law or coverage, universal health coverage, was being implemented. So here again, there's a lot of issues at hand because not all the services that were supposed to have been given were paid for, because PhilHealth could only pay so much. And even the overseas Filipino workers were complaining about PhilHealth because they had to pay the premium, which is very high, and they're not even benefiting from it because when they get sick, they use the insurance of the countries where they are working in. but they are made to pay a lot of premiums. So even the local people who are being charged are also paying a lot. So universal health care that was supposed to be the venue for making sure that health services would be available to all was not really working as such. So this is really where we have a lot of questions, because I hope because you cannot just, I'm citing the case of the migrants, the Filipino workers coming back. They, like even the testing, PhilHealth should have paid for that, but it was not paid. So they have to pay for the tests before they're able to go home to their provinces. So it took a lot of time before they were allowed. So we have so many locally stranded individuals who were left in Manila, who got sick because they were actually in areas where there was no physical distancing, or they were not even wearing masks. So these are the difficulties that we have if the government does not really provide for the needs of our people. So the universal health care law, as would have been implemented, should have provided for free quality services, comprehensive services, but because it was banking on insurance as the financing mechanism, it did not work because not everybody has PhilHealth. And PhilHealth for now also is being plagued with a lot of corruption issues. They are not able to pay what they are supposed to pay because a lot of the money has been lost to corruption. So I'm sorry, but I don't see UHC as working in the Philippines the way it should be. I don't know how it is in other countries, but even the concept itself that WHO has promoted has been transformed into universal health coverage. And it's now insurance based. So this is something that I think all of us should include in our advocacy for services, even for the migrants, because we have to go beyond just the issue. And as I mentioned, the COVID-19 pandemic really exposed a lot of weaknesses. And in the Philippines, that means the public health system was not there because we have been banking on privatization of our health services. We have been corporatizing our public hospitals. Our health services have been commercialized. And even the devolution, where I'm happy that Willie's talking about good response by the Naga City, but in many areas of the Philippines, devolution has not really worked because some local government officials do not know how to address health. And the DOH has not really made its mark to all the local governments because they keep saying, oh, it's devolved to local government. So this is where we see the need again of the national government taking the responsibility. And maybe this is something that are part of the neoliberal policies that our government is following. Privatization, devolution, budget cuts. Budgets have been cut and they expect private donors to contribute when it should be the public, the government that should really prioritize this. And I think long before COVID, neoliberal policies have been our problem in the economic policies that we have. And it was really shown hard. It was very, very evident in this time of pandemic.
And thank you, and thank you for that. And I think you've raised a very key point here, and which would be interesting. And I'd like to see how Poonam and June will actually respond to this as well. You have raised a big point in terms of public health services and how broken it is. And let's just say that it is broken in quite many parts of the world, kind of thing. It's not only in the Philippines that we have seen this story repeat itself, kind of thing. And so even when we talk about services in Objective 15, and we heard June talk about how they've expanded Objective 15, the working group expanded its from 5 priority areas to 10 kind of priority areas. So health, housing, water, and things like that. Somebody's got to pay for all of this at the end of the day. For all these services, somebody's got to pay for it. And you're making a strong case for government to play that role. But we have and we know that health services, a large part is gone corporatized kind of thing and reliant on insurance schemes. So what are you seeing therefore then coming out of this uh, in terms of how do we go about propping up once again public health services? What would it require?
Well, I see that the health department should really be on top of this. Unlike what we have in the Philippines now, the one in charge of our COVID response is the military. And so it should be a health response, not a militarist response. And here also, we're saying that there is the money. So we don't, it's not that like people are saying, oh, do not go for a free lunch or nothing is free. What we're saying here is people are paying taxes, and therefore the taxes have to be reverted back as a service. Even our poor are paying taxes because we have the value added tax or the VAT, and everything that we buy has a VAT imposed. Every service that is given to us has a VAT imposed. And so all of us are paying taxes, and we expect that the government should prioritize social services more than the infrastructure, more than the build that they're doing now. And I think it's the same in other countries also, that if you use your taxes correctly, then you will be able to provide for what your country needs. I know the experience of Vietnam. At the start of the pandemic, they immediately did mass testing for free. They provided the services for free, and they were able to control their pandemic. They locked down their borders. It was a government political will. And that's what is missing with our experience, because they put a lot of focus on what will foreign investors say, what will other people say, how about the foreign income that's coming in, focusing on what foreign investors are going to put rather than what my people need. So I think this is where political will comes in, and where taxes should support the health system, not insurance. And this can be done. I believe it can. You're muted, William. I can't hear you.
Thank you for that. And I'll come back to you. But when I come back to you, I'd like you to think about this. Is then in terms of Objective 15, this whole lineup of services that Objective 15 has, uh, in many ways to deliver it, it will have to be the governments. According to what you say, the government would have to cough up the resources for this. So then in terms of the UN advocating for this, what would be the link between the UN kind of an advocacy for it? What would be required in terms of moving governments to take this agenda on? Simply, and I'm sure you would agree, simply putting it in a document and saying this is what the world should look like is not going to happen. So what role can the GCM objectives, UN agencies play in making this happen? I'll ask you to think about that and come back as I move on to the our fifth panelist, and that is Consul General Paul Cortes. He's the Consul General in Dubai, sorry, in the UAE, but in the Dubai consulate of the Philippines. And Consul General Paul has got tremendous experience on this issue, working because he has been responsible for ASEAN Affairs, Northwest Europe, Director for Northwestern Europe and ASEAN Affairs. He has played that role. He has worked with the ASEAN Intergovernmental Commission on Human Rights, and now as Consul General in Dubai for the last 5.5 and a half, almost 5.5 years. Uh, Conjan, let me just ask you then. You've heard Objective 15 and you've just heard from WHO of all the services, and it's quite impressive: health, housing, water, decent work, child protection, social protection, sexual and reproductive health rights, gender-based violence. These are the services that could be and should be made available to all, irrespective of status, kind of thing, based on GCM Objective 5. How far do you think where you are countries of destination ready to offer these kind of services to migrant worker in your own experience, and particularly in this time of the pandemic, how much of these services were available for migrant workers?
Well, yeah,
Project, the
thank
floor
you.
is yours.
Sorry. Thank you very much again, William and Migrant Forum Asia, for allowing me to be a part of your webinar. And yes, to be very, very direct about the question that you asked. Yes, a lot of the services are made available to migrants who come over to the UAE, in Dubai for that matter, as far as access to information is concerned, access to know what procedures they must be undertaking for their labor concerns, for health issues, and so forth and so on. The MORE, or the Ministry of Human Resources and Emiratization, or the Ministry of Labor, for instance, has this system called Tawafuk, and it allows a mediation between the employer and employee when we try to resolve issues between the two parties on legal inquiries and investigating the merits of their complaints. We also have a Tashil, which is an online system for the Ministry of Labor aimed at simplifying the procedures and the transactions between employees and employer. We also have the Takim, or a system that tries to enhance the workforce stability by providing information about subcontracts and the validity of their licenses and so forth and so on. We also have Tausil, the mobile and innovative service centers for those who cannot physically visit the government centers. And this is very important, especially in the time of pandemic, where the actual physical offices were closed. And so a network on the app through your mobile phone would be very interesting and very helpful for those who'd like to file a complaint, especially during the pandemic, when we have a lot of companies that had, well, because of obvious reasons, closed down, and so had to cut back on their human resources by, by cutting, by, abrogating, let's say, the work contracts of many of our workers, not only Filipinos, but the rest of the other nationalities as well. So there were issues about end of service benefits and so forth and so on, the cancellation of their labor visas and so forth and so on. And the mobile application for this was very important for many of the migrants. Of course, there's also the Tauji, which is the information network on labor law. And it allows people to understand and find a way on how they could, put their labor concerns or labor issues into a system that could be looked at by the Ministry of Labor themselves. In addition to that, you have MORE, or the Ministry of Labor, really accessible to as many migrants as possible by FB, by Instagram, by all the social media networks. As far as health services are concerned, we do know that as far as Abu Dhabi and Dubai is concerned, all employees, all migrant employees must be insured, which means they have access to public and private healthcare services. As far as legal systems are concerned, of course, we do know that there is also easy access to all our migrants, primarily those who are asking for labor complaints. They have hotlines at the call center. They have the mobile applications and so forth and so on. A customer service to find out their grievances and how they could resolve and seek redress for these grievances, settlement of salary issues. And again, all this is looked at by the Ministry of Labor, that to allow our migrants easy access and quick resolution to their complaints. We also have various services for occupational injuries and accidents, ensuring that all employees get coverage from their respective employers in case of occupational hazards. And this is also there's also an access to job opportunities, which means if you want to look for another place of employment, the MORE, or the Ministry of Labor, has a virtual market where expats can actually search and apply for these jobs for them. Of course, all these are part of the UAE's commitment to come up with Objective 15 of the GCM, primarily to enact laws that would ensure the basic delivery that does not discriminate against any migrant on any other ground, and ensuring that the cooperation between service providers and immigration authorities actually empowers them all the more. And again, this is also part of their resolve to strengthen and make it easily accessible service points to these to the migrants here, and of course incorporating the health needs of all migrants in all national and local policies as far as the UAE is concerned. That's all I have to share for now.
Thanks for that, Kanjan, and that's informative. The many kind of services that are available in the UAE for migrants, and I have seen some of it myself with the kind of different systems that have been put in place. Uh, I was wondering that in this time of the COVID, when systems were challenged, uh, largely because in many ways the world was unprepared for such a global crisis. What were some of the challenges that y'all experienced in
Oh,
terms of,
well,
or migrants experienced?
sure. I always say that no other person or no other government or no other system in the world foresaw what would happen. We all thought about pandemics, but this is the first time we had actually come up with a pandemic that stopped everything else. And it was a challenge not only for the host government, for us as well, especially as we tried to be the conduit between our migrants, our people who would come to the consulate, or would seek our advice via text, via any social media platform, asking for help, especially when, let's say, one of their flatmates or one of their friends were tested positive, and it was difficult for them to identify what the process was or when their flatmate could be collected by the Dubai health authorities for proper endorsement to, let's say, a hospital or a healthcare institution. And it was difficult because we had to coordinate all these, not only with the Dubai health authority, but with the police themselves, the Dubai police themselves, who were also very overwhelmed with a lot of the requests. Note that during the lockdown, many of our Filipino nationals, and the other nationals for that matter, had lost their employment or were asked to go on a no work, no pay scheme, which means they didn't have enough money or money at all to buy food. And many would run to the consulate or message us asking for grocery stuff, asking for money. And of course, we weren't allowed to distribute food ourselves because, cooked food need to be within a health, health network as well. So we coordinated very closely with Dubai police, giving the names of those Filipinos who needed food or meals, and Dubai police would distribute these with the help of many Filipino volunteers as well to these people who were asking for food. It may have been biryani or variations thereof, but for a lot of people, it was indeed a something that was very, very good for their purposes, because, as I said, none of them had enough money to buy food, and it was difficult for those months, especially during the lockdown weeks. It was what was key then was making sure that we coordinated with the proper government agency to make just to avoid any issues with regard to health protocols or distributing food without a license. At the same time, we were also very lucky that we had the UAE Food Bank coordinating with the consulate so that we could also give proper relief to our kababayans or our fellow Filipinos who were asking for and begging for assistance.
And I think that was a challenge faced by many migrants across different countries of origin, and how missions came to support. But the how does the mission coordinate with some of the community organizations? I know the Philippines has very many community organizations. Were they able to play a role in accessing some of these services and things like that?
Definitely, William. From the very beginning, I had imagined that our office of 60 or even 70 staff could not go on a one-on-one relationship with 800,000 Filipinos. It's just so mind-boggling, obviously. And you needed not only other Filipinos, but you needed an organization. You needed people to help you out, reach to more of our nationals. Obviously, as I said, you cannot call them one by one and understand it for them to give you whatever it is they need, but they can use the network of Filipino community organizations. You had professionals, the architects, the Filipino engineers. You had social civic subgroups within the Filipino community who would message us, and us directing them to the right network and information. It is very important that we made sure that civil society and through the Filipino community organizations work hand in hand very closely with the Philippine consulate. Otherwise, it would have been an exercise in futility for us to just reach out to as many people without even trying to do it in a systematic manner.
And I think this is, thank you for that. And I think this is important for us in the webinar to understand as well. So even while Objective 15 talks of all these services, all the different kinds of services, we've just heard in the webinar so far that government does fall short sometimes, the role of that and other stakeholders, at the local level, at the country level, at the mission level, at the community level, somehow each different stakeholders play a role in ensuring that some of these services are available. Of course, a lot of this is done very ad hoc, and that's the challenge, I think. How can this be built into the system? And I think this is something that Dr. Adele was also referring to. We shouldn't have to, in that sense, scramble or have it in such a disorganized way. Maybe this could be one of the learnings of the crisis, of how to prepare for this in future times, kind of thing. And I'll come back to you, Konjan, to ask you one more question, and that is in relation with the Philippines and your own role in coordination with the missions of other countries. Was there any coordination in sharing information in terms of access to services and all, and how coordinated and organized was that? I'll come back to you on that as I go back again to the panel very quickly, and then I will also go to the flow. And I see people like Lakshman, Andrew, Samuel, Jabert, Thomas. I see y'all in the webinar. I will call on you for if you could give a 2-minute kind of intervention in what you are hearing and what would be some of the challenges in terms of services, because I know that you yourselves have worked despite many challenges on seeing how these services could be made available to migrant workers. I'll come back to you, or I'll call you in a little while, so just be ready. But in the meantime, let me come back then to Dr. Poonam. Dr. Poonam, if you want to come in here and take that first question that I kind of posed to you, and if you want to touch upon anything that somebody else has said. The floor is yours.
Just to be clear, William, so the question you left me with in our previous conversation was around financing, correct? Financing of health systems and the impact of COVID. Yes, thanks. Yes, so excellent interventions from all the speakers, and kudos to you, William, also for very insightful questions and follow-ups. I particularly commend also all the colleagues in the Philippines and at the Philippines consulate for their many efforts under these challenging circumstances. I'd just like to touch upon indeed some of the points that have been made, especially, for instance, the last speaker and the discussion around consular support. Also, as IOM, we have seen during the pandemic with all the mobility restrictions, which in turn impact access, of course, to regular migration, but also access to correct information in a timely manner and access to immigration and visa services, because as we know, often it is the status, especially when you think of migrant workers, not being able to update their paperwork or work permits, and how that can also impact their access to essential services. So again, I think IOM also in its role as the migration agency has been providing support where requested in terms of stranded migrants, but we fully recognize that it is a complex issue and stand ready to support further. The other remark that particularly made an impression on me was about the need for health departments to be in the driver's seat. Especially currently when we think of the pandemic, it seems intuitive, especially to those of us that primarily work in public health matters, but also on health and development. However, we have seen that there has not essentially been the required coordination between different sectors of governments, and then also different sectors at local level, which could be a mix of public and private players. What I'm implying here is that pandemics and crises, especially in the acute phase, will always test the resilience of the systems that were already in place or that have been the policy model. And this is why we would like to recommend that the crisis presents another opportunity in some instances to essentially mobilize incrementally further political will to have this kind of intersectoral coordination. For example, while health focal persons on the one hand have been the national focal points for the international health regulations, it's the colleagues working in ministries of interior or immigration that have been in charge of managing putting in place, removing various mobility restrictions. And then you have the ministries of employment and also the private sector when it comes to labor unions and employers that have been left to deal with the repercussions, especially at local level, of the socioeconomic impact, but again, access to essential goods and access to essential services. So indeed, I think this pandemic raises a very valid issue, not only about the need of access for vulnerable populations, but also a rethink and using it as an opportunity to rethink and repurpose how the UN agencies as well, but also how governments working with other parts of the social fabric look at international health regulations, look at responding to outbreaks, and also dealing with the socioeconomic impact. In terms of financing, a few points, William. I think similar to what I just said, of course, the crisis affects different countries and within countries, different local contexts differently. It has been a function of what has been the health service delivery model to begin with, or what is the national health insurance model, if you will. Is it based on, as somebody earlier said, it's based on a payment into a national tax, which then subsidizes certain essential services or provides certain essential services for free? Is it a public-private model, which also has been the case in many countries and can sometimes work well? So it is also a myth to say that it has to once again make it only about public health services, because if you actually look into comparative health systems, various countries and also within countries, subnational governance mechanisms have had a mix of health service delivery models. I think from the migrants angle, since we are talking about the GCM, one point could be a more explicit recognition of the role of migrants themselves in contributing to this health system's capacity development. We know, for example, in the US, there have been at city level efforts made since the start of the pandemic to expedite recognition of the qualifications of migrants, irrespective of status, of their health skills or essential worker skills, and using that as an opportunity both to provide the individuals a positive role to play in the response, and at the same time enable them and their dependents to have a minimum social protection during this unprecedented moment. Similarly, some of the temporary policy changes. For instance, we saw in Italy where, again, the migrant workers in certain essential areas of work were able to be mobilized, and the government was able to either maintain their regular work permits without penalizing them, or also recognize additional individuals from these communities. So perhaps one model we need to think of is how can migrants uh, be empowered themselves, and how can policies be responsive to the problem and often find these creative approaches that work to the benefit of the migrants themselves and also the communities. No discussion on financing in a GCM or migration forum is complete without reflecting upon remittances. For those of you who've been following the data being put out there by the bank and others, the anticipated or projected negative impact on remittances has fortunately not been, at least at the aggregate level, not as negative as was estimated for these first 6 months. Of course, time will only tell with the prolongation, with the second waves in many countries, and continued economic challenges faced by host communities and migrants likewise. We will see how this continues, and that's definitely something IOM also, especially my labor migration colleagues, are closely following on. But again, some of the solutions, for instance, reducing the intermediary costs or ensuring digitization and enabling lower cost remittances that can go directly to low income households in source countries, where we know these are being used for access to services like health and food. These have definitely been seen. So again, trying to look at the problems, but also identifying some of the solutions and then seeing if some of these solutions can be replicated and can be replicated to scale. And lastly, I'd like to also mention about the World Bank effort, where this year their loans and grants through a fast track facility in response to COVID have been made available to about 100 countries. So this is, of course, at the national level. But I do recall that 2/3 of these funds have been directed directly to support health systems. So again, for those of you who are working at national and subnational level, important to stay abreast of these programs that might be coming in with support specifically for the health system because it's a pandemic, and how this can be further localized and help some of the migrant communities in country. Over.
Thank you. Thank you, Poonam, for that. And I like two things that you have said: the empowerment of migrants, and migrants feel empowered to have to take to have access to these kind of services. That's on the one dimension. You have the empowerment of migrants. On the other hand, you have also said a further political will, and where these services are kind of made available. I think between these two kind of post, between governments generating more political will in terms of services and migrants getting empowered, there seems to be a big gap, at least currently when you look at migration and the issues of migration in many destination countries, and that's why it would be interesting to see how over time this gap is kind of lessened and through the implementation of Objective 15. But I'll come back to you once I go to the flow with another question as well, and ask you to pick up something the flow might say in terms of real experiences of migrant workers. So let me just very quickly go to you, June, to say you talked about uh, this the working group and the work of the working group and the extended kind of the areas that you all are looking at. Could you share a little bit more now on that, and in relation to what you have just heard?
Well, thank you very much. Well, the working group is very much is a collection of, I mean, our members are specialized agencies. For example, you have FAO. FAO does have their own mandate, of course. Each of them, we are not overshadow those organizations that already have their own mandate, but our forum is bring them in together and and work collectively, speaking one voice of the work on access to services. We over the last year we are more concentrated at the global level, but collectively, what had been agreed is to move further down to the regional and to the country level to support countries and to start first with probably with champion countries and then expand, which is, by the way, Philippines is also a member of the champion countries, and they've been very active in the contribution of us to the UN network as the champion countries. Now, I agree with all. Thanks to the speakers, previous speakers from Naga, from also UAE and all this. I agree with you on all the issue that we have, and Poonam also, that we have on the issue of access to services and how do we deal with it. For us, of course, I would speak here both on the head of UN network as well as WHO. For us, for the WHO, we have a global action plan that there are 6 priorities in there. And with this one now, when you ask me about the question, a lot of issue about migrant workers. In fact, if you take a look at the global action plan, there's also reference to migrant workers and the global action plan developed by my colleagues dealing with occupational safety and worker health. And what the question also on whether we have received some requests from member states. Yes, we have. For example, before the pandemic, we do have requests, for example, like country like Ethiopia, where you have, that in fact, more than 80% of workers are going there on irregular channels, and there's a lot of suffering over there. So we receive requests from the Ministry of Foreign Affairs, for example, how do we help to train the embassy worker, for example, at the consulate within some countries in the Gulf states, to provide counseling to health-related counseling to migrant workers that come to the embassy or to consulate. I think this is similar that Philippines have been done for quite some time. And in fact, we even recommend them to have maybe some sort of maybe peer country with Philippines, and bring in study tours and support to learn a peer learning process that could be done. This is where we also see that country like Nepal, for example, to come and ask us, we have so many dead body coming in the body bag each week because of the issue of occupational safety. Body bag come from migrant workers with unknown cause of death and all of this. So we do have some issue like that. We also see the number of requests and proposals that are coming in from country of origins of migrants. In fact, there's several proposals that are coming in after this, in the aftermath of this pandemic, where we see many that have requests for a project related to reintegration of workers that are forced return coming back from the country of destination. So with this one, well, the way forward to us to go in one of the suggestions, in fact, the request coming in for help from a local authority is the peer-to-peer learning, for example. That's something that could be done. One some example of a kind of support. We see also the issue of inter-country and inter-regional collaboration, where I think that this is where WHO and together with IOM, we could do a lot more to bring in country to be on the table to discuss inter-country, inter-regional collaboration. We already start a couple years back between the African region, Emerald region, and the European region. But again, the pandemic had put a break on us for many of these activity to move forward, and we hope to strengthen that further. But there are also other mechanisms that have been going on. For example, the Colombo procedure, or in each region you have different that IOM is working with the Ministry of Labor, and what we try to do together with IOM to put effort that health must be included on the table, and that is not necessarily there, because what you see is that people who sit on the negotiation table mostly from WOFA, for Ministry of Foreign Affairs, where the Ministry of Health is not on the table to discuss. This is where you see the problem, as a colleague from the Philippines have speak about. They talk more about investment, foreign investment, for example, instead of talking on the need of the people. This is something that WHO had been long trying to address, to make sure that health is also on the discussion. The GCM discussion, in fact, our member state, 194 member state, in fact, even passed the resolution, the decision that health must be sufficiently addressed in the Global Compact. And that when during the negotiation, it was not easy to even put in there what you see in the text right now. I think it's point E or point F on health, and with the reference to the framework of priority and guiding principle to promote the health of refugees and migrants. So yes, there's a lot of that to be done on the inclusion. What we are saying here in the pandemic is that no one is safe until everybody is safe. And then exclusion costs more. This is something that our working group going to be working more, not only on health, but it's also in other areas, and coming out with more product and move toward the country level to support the country in the implementation of this objective.
Thank you. No, thank you for that, and I do appreciate you giving us those kind of broad broad inputs with regard to the work and with regard to the aspirations of the working group. I would like to point out, though, that one of the challenges, and you have said yourself that getting health into the Global Compact it was not easy. And it is going to be one of the biggest challenges to make access to health accessible to all migrants, irrespective of status. It's going to be a long time. Let us be honest and clear on this as well, before countries of destination really make this available to migrants. And we know also from the pandemic, and I'm glad you brought this up, that to work cross-regionally or to work across corridors, this is going to be very, very important if we are going to talk about GCM objectives and access to services, largely because one of the challenges of the pandemic was that multilateralism to a large extent was questionable, as governments went into their own national priorities or into their own inward national protectionist kind of programming kind of thing. And few of the regional processes came forward with a plan for anything, even as Europe or a Colombo process, Abu Dhabi dialogue, ASEAN, whatever you might have kind of thing. But let me just go to the flow and get a sense of what people working with migrant workers, and I'm not talking to now some of the community leaders, some of the migrant rights activists who are in the room at the moment, and to get some of their views on what they are seeing in terms of access to service. And let me start with Lakshman. Lakshman, are you there? Lakshman Basnet from the trade union, South Asian Regional Trade Union Congress. Rakesh, is Lakshman still on?
I cannot see him.
Yes,
All,
yes, yeah.
Sorry,
okay.
Age here.
All right, great. Lakshman, so you've spent more than an hour now listening to this thing of access to services. And Objective 15 saying access to services for all migrants. And you've heard our panelist. What is your own experience in relation to this? And have things changed in the pandemic? I'll give you 2 minutes.
No, it has not been changed. I mean, if you talk about the Nepal, I have known that Nepal is one of the champion countries of implementation chosen by the UN network. But unfortunately, as far as the services are concerned, they have announcements that they will, for rehabilitation, they will announce some financial aid with less interest and all those things. But when it comes to the ground level, implementation is very, very poor. And the services are also very bad. I mean, it's not even up to any standard in Nepal. It's very sorry to say that the government have not been able to procure the necessary objectives and necessary goods and services from outside the world. And the frontline workers are in a very, very bad situation. So, and most of the migrant workers are in the villages, and there are deaths, but which is unnoticed. This Madam Kano Koporn rightly said, there are many people coming into the bags from outside, at least 6, 7, 8 from GCC countries and Malaysia. Every day you see at the airport. So occupational safety and health is also very bad. And as you know that in the Middle East, when people died, they just mentioned heart attacks. And now, moreover, the contact tracing is very poor. So I would say it's alarming. It's alarming in Nepal for the health services and any other services. I mean, you have to.
Thank you. Thank you, Lakshman. And I think many of us have heard that experience over and over again, the lack of services in quite a few destination countries in terms of Objective 15. But let me go to Andrew Samuel. Andrew, I see you're on the call as well. And I know that you have been campaigning for the longest time on access to health for migrant workers. Any thoughts you have at this stage? Andrew?
Yes. Hi, William. And good day to
Andrew, a little louder.
Okay, I hope you can hear me now.
Yes, go ahead.
Right.
Go ahead. Yes.
I'll just talk to you very briefly on the Sri Lankan perspective. You know what happened when the outbreak of the virus that took place. Sri Lanka was very late to respond to the COVID situation. In fact, they're responding only now. If you look at repatriation numbers are beginning to increase only now. Until then, they kept saying, yes, we're planning repatriation, but it didn't quite happen. And in the meantime, civil society got together and we tried to communicate to migrant workers, and we used, various devices, the mobile devices that people have, and we communicated as to how to be safe in the the COVID situation. Be safe in your workplace, be safe in your shelters, and so on and so forth. And we did a 7-piece piece of communication in different languages, and we sent that. And subsequently, we saw the government responding with their own material that went. How it went, where it went, we don't know. But we used our local channels, our local networks to reach out to migrant workers in mostly in the Gulf corridor, through Instagram, through WhatsApp, through Facebook accounts and so on. And that, I think, gave them some kind of leverage in terms of, and this was the early times, this was around April. And it also gave them access to hotline numbers, but sadly, the hotline numbers were not really functioning in the consulates. Then came our general election in August, and a very unfortunate decision took place as far as the government was concerned. They started downsizing the consular services. They started downsizing the labor sections and bringing the numbers down in a time when I think people needed people to respond to, and they were losing the consulate staff, they were losing the labor sections, and they had nowhere else to go. There were instances where I think some of the consulate staff were infected as well, and they shut down the consular services. That made matters even worse, So I think, it was, like what we were saying, from the frying pan to the fire. This is what was taking place as far as most of our migrants were concerned. We are seeing the whole Dubai story now. People living in parks, and our consular staff are not really addressing some of these issues. We also saw the militarization of the COVID response in Sri Lanka. The militarization, not necessarily only for migrant workers, but for the entire nation. So the health sector was ignored. The health sector was seen as a secondary force here. As frontline people, we were seeing the militarization taking place, and the response was not extreme, not the way the health sector would have managed the whole situation. Somewhat similar to what the Philippines is experiencing, and they're experiencing that today as well. In repatriation, we really don't know on what basis was the repatriation going to take place, because there are large numbers of undocumented migrant workers, really screaming and asking to get back home. But sadly, we don't think that undocumented migrant workers would have been given first priority. I think it was the contract workers who were going to be given the priority to be repatriated. The whole repatriation cost became almost like a tour package. You had to put down a lot of money to be repatriated. Your return air passage was no longer valid. You had to pay for it. And in coming back home, you had to pay for the PCR, you had to pay for the 14-day quarantine. So it was a very costly exercise. Migrant workers who had lost wages, who had lost salaries, were asked to put down money. And this was privatized. Private companies were managing this. So I think these are some of the issues that we had to tackle, we still are tackling. And I agree with you, William, that you said, how do you address this at the national level, at the sub-regional level? And I think we need the multilateral response now. This is the time. This is the time, because we've been sending paper after paper, recommendation after recommendation to just a blind wall. Thank you.
Thank you. Thank you so much for that. And thank you for also highlighting how long this and prolonged this struggle has been in terms of access to services, and how the pandemic has only exacerbated some of this to an extent, kind of thing. So a long way to go indeed. Let me bring in somebody else again who has been working very closely with migrant workers. Sumaya Islam, I see you are in the call as well. Sumaya, can I call on you to say something with regard to your work, particularly with women migrant workers and access to services? What are some of the things that you are seeing with regard to access to services for women migrant workers? Sumaya? All right. I see Sumaya is having some problems with her connection. Sumaya, Anisur, you want to come in here and take that question with regard to Bangladeshi migrant workers? And access to services? Anisur? Rakesh, I see his mic is...
Yes, yes. I think there may be some network problem. His mic is on.
His mic... Okay, Anisur is also having some challenge with his mic. Let me come to Thomas. Thomas, you there as well? I know you are in Kuwait, but you have been doing a lot of this access to services work directly with migrant workers as well. When we look at some of these services that are being mentioned in Objective 15, which is health, decent housing, decent work, child protection, social protection, what are some of your thoughts? Are this easily accessible to migrant workers as a community worker yourself and helping migrant workers in Kuwait? Thomas? Thomas?
No, sorry.
Okay, all right. Then let me come. Okay, let me just come back to the panel first. And there is a question there, and I'll start with you, Paul, and then I'll ask Edlin to come in on the same question. And the question there is from Paddy, who it's in the saying. Two questions basically. How do you deal with undocumented migrants? As we know that access is tied to legal status in most countries, but also clear that COVID doesn't discriminate. It affects all migrants. So how can you talk about access to the services, Paul, that you were mentioning to migrants who are in an, let's say, undocumented or irregular status?
All right. Obviously, William. Sorry, am I the Paul you're referring to? Is there another Paul? Okay, okay.
You are the Paul I'm referring to.
Well, obviously, William, when we speak of migrants, we're speaking and access to these basic services. We're speaking of those who already have a job or employment here and are actually working as within the purview of the Ministry of Labor. Because obviously, when the Ministry of Labor knows that they're working, they're given an Emirates either they're given a visa, everything that comes with it. Now, if we're speaking about undocumented people, those who are here and doing odd jobs under the table, we help them as far as they're because they're not part of the system. They do not they do not fall into the categories of checking their labor contracts or whatever it is working conditions with the Ministry of Labor that does not have any record of their employment, because as we said, it's under the table. So what we do is try to help them out as far as healthcare services is concerned. Obviously, when again they're not part of any visa scheme, they cannot avail of healthcare services formally, meaning in a hospital. But we do help them out. Let's say, provide basic, if they need, something for their tummy or. How do you say it? Not over-the-counter drugs for headaches and or fever and so forth and so on. Now, if they become hospitalized, we step in by helping out with let's say hospital bills. We have what we call an assistance to nationals fund, which allows us to help our nationals with let's say medical issues, primarily bills in the hospital, medication and so forth and so on. We have a sizable amount of money made available to these sorts of services that would allow us to reach out to undocumented migrants. And we have that on record that we do help a lot as far as hospitalization is concerned, medication is concerned. If and when they pass away, shipment of the remains is also concerned, that we shoulder. And all this is part of the government's thrust to help as many Filipino nationals as possible. There are instances for example, where some of our nationals, undocumented ones, ask for assistance with regard to payment of their credit card dues and so forth and so on. While we may not be able to help them out with actual cash, we refer them to our legal retainer, who then negotiates for them with the banks, with the various institutions they owe, so that we are able to work out a schedule or refinance or restructure their loans, that it make it more manageable, that they would make, so that they are able to pay off whatever loans or debts they have, and thereby be on the path towards legalizing or working out their status, immigration status.
And I think it is a there is something. All right. Can people mute their mics, please? Okay. And I was just, and it is commendable how the Philippine government and the missions do extend services even to those in an irregular kind of status. But I was wondering, and I guess the question that Paddy is also pointing towards is, because the COVID, the pandemic, the virus doesn't discriminate. Isn't it time that countries of destination started, in a certain sense, recognize, and I think some countries did that, that in terms of making services available, which are fundamental to the security of all, to the safety of all, to the health of all, kind of thing, to make some services at least available to all, irrespective of status, and particularly at a time like this, in this current crisis, shouldn't we be coming to that stage, or shouldn't we be looking at that stage?
Yes, so William, I forgot to mention also that during the lockdown, if and when someone gets hospitalized or is tested positive and then eventually hospitalized and put in a hospital, especially a government hospital, the government took care of all bills relative to their stay inside that institution. So the UAE, Dubai for that matter, was very proactive in providing these sorts of instances, again, provided it is COVID related. Now, obviously, if it wasn't COVID related, then the responsibility would have fallen on the person himself. And if he could not afford to pay any of those medical expenses in a hospital or in a medical institution, they call on the Philippine consulate through our Assistance to Nationals Fund to help out. This is how this is how more the UAE's thrust towards helping undocumented COVID positive Filipinos and other expats, for that matter, were targeted.
Could you, in 1 minute, very quickly say that question of how collaborative was the work of the different missions of country of origin in this time of the COVID?
Yes, in the beginning, it wasn't just the countries of the main countries of origin, India, Pakistan, the Philippines, Sri Lanka, Bangladesh, but we had come up with a strong mechanism between all the consuls general here to work out procedures relative to the repatriation of our nationals. At first, it was many of the Europeans had come up with repatriation programs, and we were all very unclear about what the procedures or how these would pan through. And it was a strong interaction between the dean, in this case it was the Kuwaiti Consul General, together with all of us, trying to exchange views on how we should come up with the procedures so that we can bring our countries back, our nationals back home. And it especially during the lockdown period in April and March, April and on to May, where many of our flights were not really regular yet, we started coming up with more flights from Dubai to Manila and vice versa in June. And so we were into the mode of trying to exchange as much information as we can between the consuls general, between the consulates general, so that we understand and we have, there appears to be a uniform procedure, not only for Filipinos or Indians or Pakistanis or Bangladeshis, but for everyone for that matter, so that we can advise our people as appropriate. Also, may I may I react to the issue about repatriation I heard a while back. Well, luckily, if let's say a Filipino wanted repatriation or wanted to go back to the Philippines and ask the Philippine consulate's assistance on this, the government provided all of this for free. Of course, there has to be a little time, because also as far as Manila was concerned, there was, especially in May, June, and July, there was a maximum of 400 people entering the Philippines via an international destination on a daily basis. And so this 400 was shared not only within the UAE, but for many other countries as well. So we needed to schedule very carefully the repatriation schedules. At the same time, if let's say a Filipino could not wait anymore, or let's say their employer was the one paying for their repatriation, they could do so on their own. But thing is, if they come to the consulate, if they came to us asking for assistance, then definitely they would have gone home for free. Again, through the courtesy of the Assistance to Nationals Fund. And that still is the trust and the commitment of the Philippine government as far as repatriation is concerned.
I know that it was quite an impressive program that the Philippines put together in terms of repatriation. Okay, well, let me come to Dylan now, and to you have spoken very strongly about the role of government in creating, putting these systems for access to services, and particularly health. In relation to migrant workers, would it make sense to have, I know there is already an OVA fund, but in countries of destination kind of thing, would it make sense to have some kind of a welfare fund for migrant workers that would be used for migrant workers, particularly in situations of distress or crisis and things like that? Yeah, or in terms of even access to services, irrespective of status?
It would really be a very good source of support if you have a welfare fund. And that's what OI is supposed to be doing, the Office of for Welfare Assistance. But I think, I'm not very sure though, but the reports I hear is that there are also problems in accessing support from OWA. So I think this is where we really have to put a lot of support to our migrant workers. I appreciate what our consul from Dubai is saying about Paul Cortez, about the National Assistance Fund, or Assistance to Nationals Fund, that the consulate is giving, and other foreign embassies in the Filipino embassies are giving to our Filipino workers who need assistance. So that is really very good. But considering that some of the undocumented workers really became undocumented because also of exploitation in the countries of destination that they experienced. They had to leave the employer without notice because they were being abused or they were being exploited. And this is where really we hope that the Philippine consulate, or other embassies for that matter, for their own nationals, would really be helping out in providing justice for these exploited and abused workers. And I'm glad that our consulate in Dubai is doing this and providing support to our nationals over there who are also experiencing the same fate. So the welfare fund in the country must be translated also in the different countries of destination, because that's where the workers need the assistance most. And from the experience that our friend Paul Cortez has explained, I think it's commendable that the Philippine government is able to do this. But as a whole, what I'm trying to look for in the GCM is really the support to health services that should be made open to all our migrant workers. So I was looking for some mention of primary health care in the document, because the Alma Ata Declaration on Primary Health Care that was established in 1978 yet by WHO and UNICEF provided a comprehensive definition of health that is encompassing, and it looks at not just health per se in terms of medical interventions, but health as a state of complete physical, mental, social well-being, not just the absence of disease or infirmity. So it looks at the totality of a person, not just the absence of disease. So you have to look at the wholeness of a person, and that's the basic health services that we are looking for. So you have to look also beyond health. And this is where the Commission on Social Determinants of Health that WHO has established in 2005 has elaborated on health as a right. And you need to look at social, economic, political determinants that are necessary to make one healthy. And migration, forced migration by people is something that is based on what their conditions are in their countries of origin. The social, economic, political conditions are bad, so they are forced to look for support elsewhere, and that's why they migrate to other countries. And doing so means leaving your families, the social implications of that, and your health will also deteriorate in the sense of mental health when you are anxious about what the conditions of your families are. So I think looking at health in its totality will have to also look at the role of government, because clearly in the Alma Ata Declaration on Primary Health Care, it elaborates on responsibilities of government in ensuring that the right to health is attained. And therefore, if you are really looking at what the root cause of migration is, like social, economic deprivation, poverty, etc., then government should address those issues so that migration will no longer happen.
Thank you.
So these are the issues that we really need to look into that affect migrants. So
Thank you.
government should really look at the different documents, especially the primary healthcare document that is more encompassing, and the social determinants of health.
Thank you for that. And I think you've raised a very key point, even as we come to the conclusion of our webinar, and that is to understand, and I'd like both IOM and WHO to respond to this, largely because while the GCM Objective 15 does put together a very good package in terms of access to services, like Adeline has said, and many of us know, that many migrant workers move because of lack of services in the country of origin, and then they seek to go abroad to be able to earn enough to pay for some of these services, kind of thing. So the system is inherently kind of very challenging in terms of access to services. So how do you take this into how do you factor this into the implementation of Objective 15? And maybe I could ask to the two people, but before I come to the two of you two, I see Patrick Taran as well in the webinar. And Patrick, can I give you a minute if you want to come in here and give your thoughts? Patrick Taran.
Yeah, sorry.
So you can say.
Hello. Is my
Hi.
microphone on?
Yes.
Yes,
Okay.
it is, Patrick. Go ahead.
Thanks, William. You might hear in the background a little bit of distraction. My second son was just born 5 weeks ago, so we are a bit
Congratulations.
a little bit distracted.
Yeah.
But anyway, yes, I wanted to come in, and I want to come in, I think, with perhaps a kind of fundamental question or comment on the logic of services to migrants. Because in my experience, the challenge is that not just the access, but the provision of services to migrants, and making sure that all migrants not only have access, but that the services provided are available, they're accessible, they in physical terms, as well as simply that you have the right to access them, that they ensure language, for example, translation of materials, so that people who don't speak the migrants who don't speak the host language of where they are located also have the ability to use those services and to have, for example, their health, their social service, or even legal protection needs met. I think another aspect that I would underline is that the whole debate in many places, and I heard it here, needs to start with that people have a right to these services. You know, I'm struck by the fact that NGOs or civil society organizations, or sometimes consulates, have to intervene on behalf of people in, for example, Gulf countries who are working there, because the health services that exist, it's not only that they don't have access to them, the whole logic is they don't have a right there, and if they're not employed, they don't have the possibility of even pretending to meet their emergency needs when they go to a hospital. And I was actually participating a little earlier on another call with, and actually a GCM assessment call with multi-stakeholders for the Africa region. So I'm sorry I missed Kankoporn's presentation, but I just wanted to come in to note that this topic is particularly relevant because I'm now working, or my team, I should say, is working to support the UN Network on Migration Working Group on Services to Migrants, to develop a compendium of examples from around the world, and to develop criteria to really be able to feature, write up, and disseminate examples of what we could call good or inspirational practices on how services are not only being made accessible, but really being made inclusive of all migrants wherever they are, and for whatever services, in a whole broad range of services they need, from consular services to health, housing, and so on. I'll leave it at that, but I think there's a lot more to say, and thank you, William, for inviting me to say a few words.
Thanks, Patrick, and thanks for that, and thanks for pointing this out. I think it's very important, and I'll ask you, Poonam, to actually make a comment on that. And congrats, congrats, and I'm looking at your newborn son. Hello. Fantastic, just to say hi. Hello, great to see you all, great to see you all. Just to say that Poonam, Patrick pointed out two very important points. It's not just about access, it's about provision. And we've heard from the calls, from the flow, many people share that the provision is just not there. And that it is a right. That the services is a right. When do we come to that point? And if you want to make a comment on that as we finish. Poonam?
Thanks, William. I see we've lost Jim from WHO. I believe Patrick is also working with the Health and Migration team there to advance some of the work for the working group. So good to see you here. I think in terms of, there was actually a previous point you made, William, as well, before Patrick spoke, and that sort of reminded me to make this point about not looking at the objectives in silos either. So when we talk about access to services, and we talk about the many considerations that go within that to make it equitable, whether it's health or education or other social services, it is important to bear in mind that this needs to be streamlined across any national GCM plan, especially when we think of champion countries. So what do I mean by that? It's about making sure that any talk of decent work or work around labor migration should fully integrate a rather large component, if you will, that pertains Objective 15, where the GCM talks about regular migration pathways and how to ensure that individuals, for whatever drivers they may be, are not succumbing uh, to stakeholders that might take advantage of their vulnerability. Rather, regular migration pathways, and there our colleague from the consulate here will also relate to what I'm saying in terms of making services pertaining immigration and visas more migrant friendly and more accessible without high out-of-pocket fees. We always think about, the money being paid for a particular service at at the point of service, but we have to bear in mind that the access to services pertaining health are also impacted a lot by what the overall migration policies may be. So I just wanted to emphasize this need to look at the various articles in a holistic manner. Social protection, there's been a lot of talk around portability of social protection. I hear colleagues from the Philippines about challenges around PhilHealth. Yet, on a relative scale, there are countries where we have no such models at all, where an individual can be mobile with a certain social protection package, however much it can be further enhanced and bolstered. So that is something else which I believe is key to ensuring access to services as well. And if I understand Patrick's point correctly, and please, William, you can clarify if I have not, he's talking about not looking only at access, but also how, whether or not there are competent health service capacities. Okay, so indeed health system strengthening, and this to me, this is what I meant earlier in the session, that the crisis has only further exposed and has led to results depending on the strength of health systems and social systems to begin with. So where we do not have enough capacities, and these can be financial capacities, these can be infrastructure capacities, and most importantly in the health system, these can be health workforce capacities, be they medical care professionals or be they community health workers, and how well are they integrated in the national health system. So definitely when we speak of health services, it is a product, if you will, of the strength and of the health system. And like I said before, when we speak of UHC as well, the emphasis is on progressive realization. So while there may be a lot to be done, it's also important to bear in mind that every small step, and your constituency that is listening to this webinar, but also others who are not here today, every small step taken in the right direction is going to make that incremental impact towards progressive realization.
Thank you. And thank you for that. Unfortunately, we have lost June. She had to leave and Willie had to drop out because his connection was very bad. Conjan had another. So we will conclude. We've gone over 7 minutes. But I thank you to all the panelists who threw light on this Objective 15. And just to say towards the end, is what we heard today is that the Objective 15 does talk about access to services, and the pandemic has only shown us how poor some of these services, the state of some of these services were, the poor and the public health systems and things like that. And the pandemic only exacerbated that even further. So there is a long way to go. We've seen some examples of how missions, local government, some governments, some states, host countries, countries of origin have tried to address some of these gaps, but we know also that they have been fallen short in many instances. So there is indeed a long way to go. We've heard from the flow as well. Migrants themselves have and their complaints and their challenges and their sense of strandedness and hopelessness in situations like this, when we realize there is very little being done and how much more could possibly be done. So we've got a long way to go, and like Patrick had said, and how Poonam has just now said, we have to consider these services as a right. We live in a time where we need to start recognizing this as a right, access to services and the provision of these services. And the little progress that we can make in the realization of rights, of this as rights, will go a long way in realizing in some ways what the economic, social, cultural rights framework set out in 1948. So we are very far from that realization. And even if we talk of progressive realization in small incremental steps, there is an urgency on the ground at the moment. And the urgency on the ground is in the lives of millions of migrant workers who at this time, and even as we are in this webinar, are struggling to receive those services, whose development plans or whose development trajectories have been set back years simply because of the COVID and how it has impacted their livelihoods and and the situations of their families. So let us think about that as we move forward in looking at how to bring about the implementation of Objective 15, but in totality with the other 23 objectives. I'd like to thank each of the panelists and the people from the floor who took the room, from the room who took the floor, and for all of you who attended this webinar today, for those who have journeyed with us up to this objective, thank you very much. Like I said, this is the last in our series for this year. We will come back with Objective 16 on the 15th of on the 5th of January. On the 18th of December, we will have a special session in which we will talk to a panel that was engaged in the negotiation. So we will actually have a discussion with people that were engaged in the discussions of the Global Compact. And tomorrow we have a webinar on looking at the impact of remittances and wages and loss of wages in the lives of migrant workers. But do join us if you can. It's been a good 16 Tuesdays meeting each other in this platform. We hope that with the story of the vaccine that we will see a lot more hope in the coming year, and definitely we look forward to continuing this series in the coming year. I'd like to thank all the co-organizers, Action Committee, CCRM, GFRTD, DT, who have been co-organizing this webinar series, my co-moderators, Rola and Paddy, who have co-moderated some of these sessions. Thank you all for the wonderful work that was done in these last 16 Tuesdays to 15 Tuesdays together, and some of the other work that we have done alongside this. Once again, thank you to the panelists for your time, for your insights, and we look forward to an ongoing conversation on how to realize what is on paper, how does that translate into the lives of migrants so it becomes real and we bring real hope and real transformation on the ground. Thank you so much.
Thank you, William. Thanks,
Thank you.
everyone.
Thank you, William. Thank you, everyone. Thanks for the opportunity to share.